So, I know you're out there in the world a lot, talking to people, trying to help them out, get them into treatment. And how many times do you hear people say, what's going to work this time, or what works?
Yeah.
Yeah?
Every time almost.
So what do you tell them?
Well, for one, I'd say we don't have a cure for addiction.
Okay.
But that being in a place filled with professionals and safety and security, like they have a better chance of figuring out exactly what is the next plan.
Okay.
We're not necessarily as treatment, we're not providing, it's more like triage than we're providing the entire, like, this is the rest of your life when you come here.
So you're trying to be realistic, but hopeful.
Hopeful, absolutely.
Okay. So have you ever heard anybody ever try and say that they know what works?
Yeah.
You have?
Yeah.
So what's your first reaction when someone tells you that they know what works?
Pretty sarcastic, where I'm like, that's great.
So in other words, you sound skeptical then. You sounds too good to be true kind of a thing?
Yeah, because I think that, I mean, if a person knows what works, one, I don't think there's a blanket treatment for every human being. There's just no way. Okay. If there was, then there would be one form of treatment everywhere, and everyone would go to it, and we'd all be good.
Right.
Right.
Okay.
So there's tons of pathways to recovery. And then the other way is when it's somebody coming for, say, to ask for help, and they're like, I know what works. I'm like, do you know what works if you're calling to get help? Because it didn't.
Well, wait a minute. Why would a person who's calling for help to get in treatment tell you they know what works?
It's a really good question.
Kind of doesn't add up in my book.
No, but it happens.
You know.
Or rather, they usually are like, I know what doesn't work. I'm like, well, have you tried it? No.
Okay.
Okay.
That makes more sense.
Yeah.
So, for me, whenever I hear someone, saying, this is what works, well, yeah, it makes me feel skeptical too. I think that they're overstating their claims because there is no one thing that works. So, what we say here at Recovering Champions, or at least I say it, is, well, before I answer that question about what works, let me just restate it as what we are finding works best.
Right, evidence-based.
Yeah, evidence and experience-based. So I think it's important to take that question and to reframe it. What are we finding that works best? And, so that does involve a bit of a longer answer, which is one of the reasons why people like the answer to what works best, because they don't want to hear the long spiel.
No.
They want to hear something simple, cut and dried, okay, moving on here. And they just don't have the patience for it. But unfortunately, it's a little more complicated than that.
Yeah.
So, well, if you have time, let's sit down and talk about what we're finding out works best. And hopefully we can get them to sit down and do that. So, what do you think should go in that what works best pot? Start throwing stuff in there.
Well, there's evidence-based practices such as...
What does that even mean?
So it's proven ways of different therapies that actually work for individuals.
Proven to whom and by whom?
Different research.
I'm being cynical.
I know, I love it, but
Okay.
there's different research practices. I mean, there's
Give me an example of an evidence-based practice.
cognitive behavioral therapy.
Okay, good enough. All right, there you go.
Test one.
So there's one. Okay, yeah, evidence-based practice treatments.
Yes, evidence-backed. Right.
Easy for you to say.
Yeah, easy for me to say. There is the 12-step fellowships.
Okay.
There is Smart Recovery. There's Refuge Recovery. There is other small groups. There has been in different researches, group therapy has always been one of the higher success rates. Church, meditation, yoga.
Okay, what about
medication?
What works best? Okay, how about 5 days of detox back in the community?
Nah.
Works like a charm every time, right?
So it's always recommended that a person stay in treatment as long as they can.
Now we're talking. Okay, so
regardless, that is always a blanket suggestion because one, it gives the person more time to have that safety and security, to learn the coping skills, to have the evidence-based practices, to be introduced to all the different avenues of recovery.
Get better at what they're not good at and all that kind of stuff.
And it gives their time for the brain to heal a little bit so that they can make better informed decisions.
Okay, so now we're talking. So what works best? I want to add a few things to your things in the pot, okay? All right, so first of all, I want to say that, especially the parents of the kids or the husbands and wives of their spouses that are coming into treatment have suffered so much, and they're just desperate to feel some kind of hope and that we're really going to get somewhere this time. So I think that what's best to give them that is to give them real answers, without extravagant promises and guarantees. And, not to beat around the bush that it's going to be a fair amount of work and might take a little more time than they want to spend. But, if they're willing to commit to treatment that includes all these best practice elements, we're really decreasing the odds of relapse, increasing the chances of success.
Yeah.
And that is what we find works best. So the first thing I start with is I tell people that it really helps when people complete each level of care. Mm-hmm. It really helps to not walk out of treatment before your treatment time is over.
Yep.
And so you finish your detox, and the next thing is not to skip levels of care. And after detox would be PHP or maybe residential. Yeah.
And then PHP.
Yeah, residential and PHP, and then after PHP would come IOP and then OP. So the way I look at it is it's kind of like a ladder where you're going from highest structure of treatment, and each time you go down to the next level, you're going down in structure, mm-hmm. right? So if someone were to skip levels of care, they're going from something's higher to way lower,
yeah.
and that kind of transition from high to low or to no structure is a really high risk factor.
Absolutely.
And the other thing is when you go from one level down to the other, you want to make sure you're installing something in respect to treatment plan that kind of makes up for that loss of structure so that they're supported all the way through. So complete your levels, complete your treatments, and then don't skip levels of care. Mm-hmm. All right. The other one would be continuity between levels of care. What do you think we mean by that?
To go right from the first treatment down.
Well, that's part of it, yeah, because we
no gap.
Right, no gap, yeah. So
no stopping home to get all your clothes before
right,
you
okay,
go
no gaps. Right, no gaps. The other thing to me, continuity has to do with the people you're working with and the people you're in recovery with, the treatment team, the milieu, and all that kind of stuff. So.
Yes.
Transitions in general are very difficult for people in general, but especially so for people in early recovery.
Yeah.
So you go to detox, and then you come to residential, and then you go to PHP, transition. And each time you transition, you're meeting a whole bunch of new people.
Yes.
You got to tell your life story to get another therapist.
Mm-hmm.
You got to open up to more counselors, and but by establishing continuity as you go through levels of care under the umbrella of one or two organizations, you're minimizing those transitions, right? So the way it kind of looks here would be you do PHP, you're at that level of care for a while, then you carefully plan your transition down to IOP, you might be going into the community, but you're still with your therapist, you're still with the nurse, you're still with the doctor, you're still with the same residential staff, you're still kind of in that bunch of people that your cohort that you've been in treatment with, and it's all very supportive, and it just gives you more time to do your healing and growing and recovering without another transition setting you back to square one in terms of meeting folks and opening up and trusting again. So that's what I mean by continuity, wherever possible.
Yes.
So what else do we say? The other things that go in that pot would be more circumstances, like for instance, a lot of people are very eager to go home.
Oh, very.
Right away.
Go home.
So what can we run into when we're like in a rush to go back home or to our hometown or, that kind of stuff?
What do you mean, what we run into?
Yeah, like they're in a rush to do that, but what do we run into? What can that do to their recovery? What are the things that can happen?
Well, while they're in treatment and they're trying to run out, they're not focusing on treatment.
Right, but
It can interfere with their
hey, I'm
academic
sober,
plan.
I've been hitting my meetings, I'm doing all my work, I'm going home. Downtown Boston, live right near, Miracle, Methadone Mile, no big deal, but anyways.
I think it sets them up for to continue impulsive behavior and not to slow down and be able to make decisions.
Why?
Because it's impulse.
to go home.
Right. It's an impulse.
Is it just an impulse?
No, I mean, it's also compulsive and obsessive behavior.
Why would a person want to go home? Let's keep it real
Because it's
simple.
the safety and it's
Yes.
the comfortability. It's something that they know. There's no
Right.
fear or unknown
Right.
that they have to run into when they go home.
Right. But why would that be a bad thing? Or why would that be a negative thing, possibly?
Because what's comfortable has obviously been part of the reason why they came to get
Okay.
help in the first place.
All right. I get it. All right. I was just trying to grill you a little bit to see if you...
I got answers.
so-
I got answers. Let's go, Toe.
I think that well, I was explaining it to one client that if you go home before the cement you poured is set, it can still be stepped in and messed around. You have to let things settle and set before you go home, because unless you're set and you're more established in your recovery, you can very easily get drawn back into the old dynamics of it, and they may very well be well-meaning.
Yeah.
Of your roles, your relationships, your patterns. And I'm not saying that people want to mess you up, but you're right. It's comfort. It's what's known, and it can draw you right back into it without you even knowing it. And pretty soon, you're using it again, and also people aren't always aware how enmeshed their families or their loved ones are in their addiction. Mm-hmm. And so to return home to that relationship is actually, in a way, returning to an aspect of recovery that hasn't really been addressed yet, or an aspect of the act of addiction, maybe not in the drinking or using form, but in the behavioral form. This speaks to, we've talked about this before, the relapse cop, where you go home and your loved one is so focused on your sobriety that they're actually working harder at your recovery than you are, and that actually doesn't help you stay sober. Most people end up drinking and drugging sooner rather than later when that's going on. So time is a big one, I don't know, it's hard to put an exact number on it, but
I've always heard the 90-day rule. One, because
I didn't want to say it, but I was thinking that,
because more than likely, so for insurances, you can maximize up to 90 days in treatment when you go from different levels of care.
Well, from
you have a better
detox all the way to outpatient.
Right, if you're doing the continuum of care. So if you go from detox to residential to, you can even do detox to clinical stabilization, and then go into residential, and then do PHP, then drop down to IOP and OP. That, with your insurance, can maximize up to 90 days of treatment. With the max cost to you as a co-insurance, co-pay, or deductible.
Well, we've had clients here, as you know, that have been in treatment for over a year, but for 11 or 10 months of that year, they've been doing OP.
Yeah.
And in some ways, I view the outpatient part is the most important, because really at PHP and IOP is where we're establishing the foundation of their self-care plan, so that they can go back in the world and start to live life as a sober person with that integrated into their lives. And
they always have that support that they built while they were in treatment when they're out in the world.
We know them,
right.
They know us. And
real life is not when you come to treatment, real life is still going on, but it's very difficult for them to, how do I say this? We can present all the situations they can run into, we can present all the stressors, but they're not experiencing them.
Right.
So OP is essential because of that fact, real life will hit them.
I tell clients that the real world doesn't care that you're in recovery.
No.
So be prepared. But the point is, the outpatient part is where people really begin their true growing and changing.
Yeah, they start having jobs. They start really rebuilding their relationships with their family and trust. They need that clinical support. So
time, and then of course the other things that we throw into the pot are, the meetings and all the foundations and the elements of self-help recovery, for which. Some people aren't into the meetings, but they still nevertheless provide a very important role, and we can talk about that in a minute. So there you go. That's what works best. Completing your treatments, not skipping levels of care, wherever possible, connecting levels of care continuously within the same treatment realm, so that you're minimizing transitions and you're sticking with the same group of people, like your support group or your cohort or whatever you want to call it. Considering delaying returning to to your neighborhood, to your family, to staying apart from that for a while, so you can grow independent of that and not get sick back into old ways. Think about treatment as something that's extended rather than defined.
Yeah.
And then, of course, there's the things you have to do to take care of yourself, a lot of which would be reflected in your daily activities, going to meetings, having a sponsor, joining a home group, having a service job, doing the steps, that kind of stuff. So what I tell folks, there are a couple others too, and we'll talk about these at another time, but like some people need MAT.
Yeah.
They just have never been able to stay clean, and we're not going to get into it today, but for some people that may be recommended.
Absolutely, it is a pathway to recovery.
Right, and for some people they may need treatment that's specific to issues that they brought in with them, like
different traumas.
Trauma, or co-occurring mental health disorders, things like that.
Or eating disorders,
right,
and other
right.
things like that.
So hopefully when you come out of, the higher level structure, more structured levels of care, you're coming out of those with a self-care plan, and that will reflect your unique needs, and that you will maintain those as you go forward in your early recovery. So the more those things you stack together, the lower the odds go, the higher the odds are of success, and that's what works best. And so, if the people that you're explaining this to are still awake after you've explained all of that, then you're having a good day. Most people are really eager to hear straight talk and not sales talk. They're really eager to hear that.
Absolutely.
And I've had many, so here's the other thing though. One thing we're trying to do here is to not just tell clients what they need to do, but to have them think about why they need to do the things they need to do. And this brings up the concept of doctor's orders, okay?
No.
So you ready for that?
I'm ready for it.
So
Toby.
if you have a really bad cancer, you go to Dana-Farber and they diagnose you.
Yeah.
And you go in to see the doctor, and it's pretty overwhelming and it's pretty scary because it's so life-threatening. The doctor might say, okay, well, listen, we've got a situation here. It's pretty serious, but we think we can beat this thing. Are you all in? And of course, we want to live, so we're like, yes, tell me, I'll do anything. And said, okay, well, it's going to be tough, and it's probably going to be life-interrupting, and it's not going to be all that pleasant, but if we do all these things, you're going to be fine. And you say, yes, I'm all in. And so doctor's orders is the goal. I say to clients, do you think that cancer patient is happy to go up there and do all that stuff?
Nope.
Do you think that the cancer patient is always motivated to do all that stuff, that they never get complacent or fall off the program?
Nope.
No. But they stick with it, and they do the best they can, and eventually they come out of it with a cure, or at least a better life. And so the doctor's orders and the work we do in early recovery, the goal of it isn't necessarily to enjoy it.
No.
And the expectation certainly isn't that you would always be up for it and motivated in a super duper way every single day. It is a lot of hard work.
Absolutely.
But it's really no different. Addiction is fatal, right? We know that.
Absolutely. More so nowadays than it was.
Why do people? I don't know. It's just a question for the universe.
What?
Well, I know more people that have died from addiction in the last, say, 6 months than people died from cancer, and yet people don't kind of see it as an immediate pressing danger.
Well, I think that the one thing that I always talk to about families and loved ones now, that I've heard it, and I was like, that makes more sense than I've ever said anything before. A drug addict or an alcoholic, right? I'm a person in recovery. When I was active, I'm insane.
Okay, so
right? So how can a sane person understand an insane person?
Bang. So it's like a brain disorder.
Right, so
So-
how can people viewing people dying from addiction truly understand? Because they're sane people. You don't understand the insanity that would lead us to fatality.
And the other thing is the person who has the addiction
Who
isn't going to
knows?
think in a sane fashion.
Right.
And they're going to say, yeah, that makes a lot of sense until they want to use again. And then, okay, so,
Yes.
yeah. Well, that's
First,
why.
the person has to obtain sanity in order to see the logic behind it,
Well-
which takes us a while.
Well, actually, that does bring up some interesting points that some people's use is so compulsive and so irrational that we are kind of wasting our time to them trying to give them a rational explanation.
Right.
We could use all the great Toby metaphors, you know, or Alyssa pep talks about doctor's orders and cancer this and, you know, and they just don't hear it because their brains work differently. So sometimes doctor's orders do include more what I would call stringent prescriptions
Yeah.
to protect them from their irrationality and their compulsiveness. And that might include what do you think? Like what would be something you'd have to do to protect someone?
Continue therapy.
Well, no, I'm talking about someone who's using very destructively and can't stop themselves and keeps doing dangerous things and is
Sectioning?
Well, that would be the most drastic.
Yeah, that's drastic.
Section
yes.
35 is what we're talking about here,
Yes.
and that's a civil commitment for
They've
people
gotten
who.
much better. They put them in treatment centers now.
Right, that's good. Good to know. Yeah, so the Section 35, a civil commitment, is something that people have done to protect their loved ones from killing themselves because their addictions are so out of control. But there are people who have an aspect to their use that's very compulsive, and they, even with the best doctor's orders, they don't really have a sense that they're in danger to relapse until after they picked up, or they are finding themselves picking up even when they know that the immediate consequences could be so negative.
Yeah.
And for people like that, they often need the highest level of extended care, which outside of detox and residential, which would to me be
Like a halfway house.
a halfway house, yeah. And for them,
Yeah, that's a total other branch that you
Yeah.
can take. You can even do residential, PHP, IOP, OP, and then go to halfway house, actually.
what I've explained to clients is that you've maybe heard me talk about this too. Is like if
Probably.
you have like a bone cancer, they have to like irradiate and remove your marrow before they transplant the new marrow in. Have you ever heard of this?
Yeah.
Yeah, I have a cousin who went through this. And so for a period of time, they have zero immune system. So they are unable to be out in the real world because the simplest bug will catch them and kill them.
Yeah.
And so, and all the willpower in the world and all the therapy in the world isn't going to give them an immune system. So
No.
what do they have to do? They have to be in the bubble and they have to be very careful. They need a very sterile environment until they can regenerate an immune system. And some clients don't have an immune system in the sense of being able to
Fight
keep
off
themselves
addiction,
safe. And they need to be kept in a sterile or a pristine recovery environment. And that's what some extended levels of treatment like halfway house would provide. Not a guarantee, but it would just increase the chances even more.
Absolutely.
So doctor's orders. So that brings me to the vital signs piece. So if you're that diabetes or cancer patient, you have a chronic or an acute illness, and you go in to see the doctor, what's the first thing that they do whenever you go in to see the doctor?
Check your vital signs.
Why do they do that, anyways?
I don't know. That's how I don't know.
You don't know why? See?
I know I have to have my vital signs checked every time I go to the doctor.
Okay,
That's
so-
all I know.
My primary care physician said, a good physician can diagnose 90% of all human ailments from a simple physical exam.
What?
Yeah.
That's
And that
impressive.
includes pulse and respiration and,
I feel like once my cousin sees this, because he's like the top hand surgeon in the country, he's gonna be like, Alyssa, that's
well,
really bad.
he's, okay, well, he probably doesn't give people, check their vital signs. He just
No,
does
he, like,
operations
saves.
and charges big money for it.
No, he saves there's
Oh, okay, all right.
He's,
So
he's a big deal.
I'm pushing on my agenda here.
Hey, Dr.
So,
Davis.
so pulse and blood pressure and respiration and body temperature, whack your knee, and those vital signs can tell physicians pretty much how you're doing. And if any of those things are off, then they go in a little bit closer to look at what might be going on. and it could reveal, you know, like maybe a spike in your illness or a regression or something like that, and could be cause for concern, or we're just going to get back on track, you know, like your blood pressure's a little bit up, so let's take a look at this, take a look at that, and get you restabilized. And I think for our clients, we want them to look at their self-care plan as kind of like the vital signs. So when my clients from outpatient come in, they hate me for this, but I always start out with, okay, let's do the vital signs. And they know that to mean what? What am I checking in on?
All different areas of their life.
The simplest ones, think simplest ones.
Health.
No.
Or no, you like break it down?
Well, like for their recovery, what's their recovery vital signs?
Meetings.
Yes. When's the last time you called your sponsor?
Yeah. Food, sleep.
Yeah, of course. That's right, self-care. So we go down all those things. And also, and even though that's kind of a simple check down, it can tell you a lot.
Oh, absolutely.
And you and I, we know some clients that maintain a very distant orbit from here, and they have to be kind of reeled or tethered in. And so they're not going to, I don't expect them to hit meetings every day, but I do expect them to hit meetings and come into counseling at a rate that kind of meets where they're at, reflects who they are. But that's the point with every client, is we have to know what their vital signs are, what their baseline is. And that can be a good indication of where they're at. And there's a couple kids that I've been working with who it was getting harder and harder to get them into counseling, and what happened, they had a little slip up, and we got them back into treatment. So, but it would have been nice if I'd been able to see that their vital signs were a little bit off before they relapsed.
Yeah, well, I always think that it's good to disclose that the individual or the client also has to understand that they have to buy in.
True.
I think that a lot of people in more recent years have started coming to treatment with the expectation that recovery would be handed to them. Even though they have the logic to understand it won't, they're still like, well, what did you do? And I'm like,
right.
I waited here for you to show up, which is my job.
Well, so back to the thing about sane and irrational versus
right.
rational and sane is that when they start talking like that and acting like that, to me that means that kind of the balance of the healthy part of them and the addiction part of them has kind of gone off kilter, and it's more like the addicted thinking is back in control again.
Mm-hmm.
And
absolutely.
And that's so when we confront them or we reach out to them, they kind of they push us away, or they're dishonest, or they get kind of confrontational. That's yet another sign. But we have our ways. I think we're pretty good, right?
Yeah, I usually just go like, once I know for a fact, I'm like, what's up, dude?
Right. Right.
Very non-confrontational.
Right.
And they're like, I'm good. And I'm like, are you sure?
Right.
Because that don't seem true.
Well, I will say the good thing is...
They do get honest.
Yeah, yeah. And the other thing is that sometimes recovery is not just measured by length of clean time versus using time. It's how quickly they got back into treatment.
That's how I always tell them. I'm like, there's something to be proud of. If 6 months ago you probably would have been on a run for a little while.
Yes.
Still using consistently for an amount of time. And you came in after relapsing for a day, 2 days.
One kid had a single episode and he was back in touch.
Exactly.
Right?
So those are what I try to have them focus on. I'm like, I know you look at like length of recovery as like a measurement, and it is in a sense, but not truly. It's really quality of life.
Right.
So like my quality of life has greatly improved, but it's because I keep measurements of what I'm doing to improve my life.
Right.
Recovery, yes, being sober is part of that, but it's not. It's a section of it.
Right. Right. Yeah, I haven't quite figured out the complacency piece, and why, how to beat that, But I think that it's interesting, but even the cancer patient, the diabetes patient, they fall off their self-care,
Mm-hmm. I think that it happens with every person when they're battling something, and there becomes the time where it's almost like contentment is reached. Like, okay, so the plan's working, this is fine. My issues addressed at this time, but now I'm bored.
Okay.
because at least for addiction, that's what I've run into, especially with younger clients. And for me, I was one of those people. I was 20 when I got sober, so I hit complacency. And what I've found to always work, and the things I've done for my own personal relationships with people getting sober, is more so try to teach them that it's important to change the plan. When complacency hits, it's not that the plan...
Oh, that's really good. So in other words,
Yeah.
it could be going back to revisiting and recommitting to the old plan.
No.
It also might be, as a result of your growth, the old plan isn't fitting
It's not
anymore.
efficient anymore.
Right.
No.
Okay. Oh, that's really good. So, because I tell clients that, you know, speaking to transitions in life or real life not caring that you're in recovery, the promise of recovery isn't that things aren't going to happen. They do.
Right.
That if
And
you,
they get all that
Right.
stuff. Like, I always try to explain to clients, I'm like, I had the same thing. I was like, where's my parade? Like, okay, you know what I mean? Like, Mom, where's my parade? I want a floaty of
Right.
me. I'm amazing. I want a tiara.
Yep.
And then, even though everyone told me, like, Alyssa, you're not getting a parade.
You don't get a parade for just being a
The promises in the
regular
12 step
person.
are not money. Like, you're not
Right.
promised money for being sober. Like, you need to just live
It's
life.
cute.
But I'm like, but still in that back of my mind, I'm still, even though logically I know that's not going to happen, I'm like, it's going to happen. Something's going to happen. I'm going to get praise somewhere, and then it doesn't come, and it's like, well, this is kind of boring. I'm no reward for living a good life, even though my good life is the reward.
That's right. Well, that's because sometimes when we're young, we expect the reward. That's just-
Exactly, and I think that's what it has to
but then when sometimes you're old and you expect a reward like me. So, anyways, well, okay, so, but for people in earliest recovery, the vital signs as they reflect the plan, which reflects the doctor's orders, your plan for you to stay well, is something to be monitored.
Right.
And if the monitoring shows you're falling off a little bit here and there, get back on track and stick close to the plan. And in time, you can change the plan, but best to stick to the doctor's orders in faith that they're going to keep you safe and help you grow and change, keep you sober, keep you safe, help you grow and change. You know, it is a lot of work, but the key is getting them past that point where it becomes, I don't know, work that they're just having to recommit to doing every day and starting to feel some great feelings about their lives and their recoveries, you know.
Yeah,
It becomes more internalized.
Yeah, absolutely. It's more like a functioning of the day. Like it's maintenance in life.
Right. You feel bad when you don't do it.
Yeah.
Right. So the last thing I wanted to just mention very briefly is, you know, breaking down the whole meetings thing. You know, like they hear meetings. And what I want clients to know is why they have to take the medicine that we prescribe for them. You know, the doctor up at Dana-Farber or any other place will tell you why he or she is prescribing the medication that they give you, and that makes you more apt to take it if you understand what it does for you. But, you know, today with the clients, we were just talking about trauma and the trauma that you may have suffered before addiction, the trauma that your addiction caused you, and all the things you struggle with from trust and isolation and not belonging and blah, blah, blah. And look at the meetings, you know. So what does attending meetings give you? It gives you a sense of community, belonging, mattering, and connection, fellowship. And that stands in contrast to isolation, which of course the addiction feeds off of and depends on to grow. And so just by being at a meeting all by itself, you're kind of battling the addiction by not being alone, by not isolating. Sponsorship is a place where you can be, you know, a vehicle for which you can work on trust and one-on-one with someone. It's so hard to trust people, isn't it, in early recovery?
Yeah, I did some work, I realized.
You did?
For me, it was eventually after doing a lot of internal work, it was more so I couldn't trust myself.
To do what?
Be a decent human being.
Well,
So
interesting.
that's what it came out.
Is that saying that all sponsors are trustworthy and it's just you or just us?
No, but I think all humans have a different level of trustworthiness, and the expectation of me to be trustworthy meant that I had to expect it of everyone else. And
This is going to be a digression, but trust involves one person's capacity to trust and the other person's trustworthiness.
right.
And if you have someone who has no capacity to trust, does it matter how trustworthy this person
No,
is?
and I think it ties in because it has to do with treatment and it has to do with going to meetings and having sponsorship. Because you
Right.
have to, I've worked with a lot of clients when they have issue with trying to utilize a therapist, for example, and how to use a sponsor and like how to get past their trust to get to that point. And I was like, so what makes you so trustworthy? I'm like, how are you gauging trust if you have no trust? So, right. So like, how can I? So what's your gauge of trusting? And they look at me and they're like, "You suck."
Because you just asked me a question I can't answer.
Right.
Well, I think I just the
You
way
have to
get
participate.
Yeah, the way to get better at something you're not good at is to struggle with it.
Right.
And sponsorship is an area where you can learn about trust and
Right.
trusting and trustworthiness.
It taught me how to build trust with the person instead of just as prior to becoming a person in sobriety, I just assumed either trust was given or taken. Like that's it. Either I gave it to you, and I was like, oh, you earned it. Like no, they didn't. I'd either just give it to you freely, or you would give it to me freely, and that's how it was. I didn't realize that trust really was something that had to be earned on both parts.
Right.
So sponsorship taught me a ton about having healthy, trustworthy relationships.
Being a sponsor and a sponsee.
Right.
Well, briefly, because I know we're running out of time, the thing about home groups is the foundation for activity in the program.
Yeah, you're homeless without a home group.
You're homeless without a home group. And the service job could be handing out key tags, passing the basket. It gives what people are getting there is a sense of purpose.
Absolutely.
And a role,
Yeah.
And then with the steps, of course, we don't want to, this is a whole other discussion, but the steps is really reflect a lifelong commitment to growth and change, which anybody should be committed
Yeah,
to.
anyone could really benefit from
Right.
12 steps.
So in the meetings and the elements of program involvement really address a lot of the things that we're talking about, whatever path brings you into recovery. And so a lot of times we'll take time to explain what needs these different aspects, the doctor's orders, are meeting for you. And if you understand why sponsorship is so difficult but so important, or why getting out to a meeting and belonging and being active is so difficult but so important, even though it may stink that you have to live in a sober house for a couple of months before you can go home, it's so important that they're much more apt to do it. And there you go. Then you have people that are actually really getting as much as they can out of their recoveries as they possibly can. And the odds go down that they're going to relapse. The odds go up that things are going to turn out okay. And even if they do hit a bump in the road, sometimes it's a real quick bump and they're right back out there, like one of those guys we were talking about today. All right, so I guess that's about it.
Yeah,
Do we cover all the bases today?
I think so.
All right, to be continued.
Always.
All right.